Prostate cancer is a significant health concern for men worldwide. It is the second most common cancer in men globally, with an estimated 1.4 million new cases diagnosed in 2020. In the United States, it is the most common cancer in men, excluding skin cancer. Understanding the scope of this disease is crucial for appreciating the importance of advancements in treatment. The prostate is a small gland located below the bladder and in front of the rectum. Prostate cancer occurs when cells in the prostate grow uncontrollably, forming a tumor. While the exact causes are not fully understood, risk factors include age, family history, and race. The good news is that prostate cancer is often slow-growing, and many men will not die from it. Early detection and effective treatment are crucial for improving outcomes and quality of life. Hormonal therapy, also known as androgen deprivation therapy, or ADT, is a cornerstone of prostate cancer treatment. It works by reducing the levels of male hormones called androgens, such as testosterone, which fuel the growth of prostate cancer cells. Traditional hormonal therapy typically involves medications that either block the production of androgens or prevent them from binding to cancer cells. While effective, these treatments can cause side effects such as hot flashes, fatigue, and sexual dysfunction. Advancements in hormonal therapy have led to the development of newer drugs with improved efficacy and fewer side effects. These include second-generation anti-androgens, which block androgens more effectively, and novel hormonal agents that target different pathways involved in androgen signaling. These advancements have significantly improved the management of advanced prostate cancer. By effectively controlling hormone levels, these therapies can slow tumor growth, alleviate symptoms, and prolong survival. PARP inhibitors are a class of drugs that have shown promise in treating certain types of prostate cancer. They work by inhibiting poly-ADP ribose polymerase, or PARP, an enzyme involved in DNA repair. Cancer cells, including prostate cancer cells, often have defects in their DNA repair mechanisms. PARP inhibitors exploit these defects by preventing cancer cells from repairing their DNA, leading to cell death. Clinical trials have demonstrated the effectiveness of PARP inhibitors in men with metastatic castration-resistant prostate cancer, or mCRPC, and specific genetic mutations, such as BRCA1/2 mutations. These mutations are involved in DNA repair, making tumors more susceptible to PARP inhibition. The approval of PARP inhibitors for prostate cancer has expanded treatment options for men with advanced disease. These targeted therapies offer a new line of defense, especially for those with DNA repair deficiencies. Immunotherapy and beyond, unleashing the body's defenses. Immunotherapy harnesses the body's immune system to fight cancer cells. Immune checkpoint inhibitors show promise in treating various cancers. These inhibitors block checkpoints, unleashing the immune system. Immunotherapy shows potential in mCRPC patients. Clinical trials are ongoing to evaluate its efficacy. Section 5. Radiation advancements and focal therapies. Precision is key. Radiation therapy has long been a cornerstone of prostate cancer treatment, and recent advancements have further improved its precision. Traditional external beam radiation therapy targets the prostate gland from outside the body. Intensity-modulated radiation therapy, or IMRT, delivers precise doses of radiation while minimizing exposure to healthy tissues. This reduces side effects and improves outcomes. Stereotactic body radiation therapy, or SBRT, delivers high doses in a shorter course. SBRT is beneficial for localized prostate cancer. Focal therapies treat only cancer-affected areas, sparing healthy tissue. These include HIFU, cryotherapy, and focal laser ablation. Focal therapies offer fewer side effects compared to traditional treatments. Section 6. Conclusion. A brighter outlook for the future. The landscape of prostate cancer treatment is constantly evolving, with new therapies and advancements emerging regularly. From advanced hormonal therapies and PARP inhibitors to immunotherapy, radiation advancements, and focal therapies. These innovations offer hope for improved outcomes and quality of life for men diagnosed with prostate cancer. While prostate cancer remains a significant health concern, these advancements provide a reason for optimism. With continued research and innovation, we can strive for a future where prostate cancer is no longer a life-threatening disease, but a manageable condition. Early detection through regular screenings and open communication with healthcare providers are crucial for improving outcomes. By staying informed about the latest advancements in treatment and working closely with their doctors, men can make informed decisions about their prostate cancer care.